surgery can absolutely cure cancer if you can debulk all of the cancer cells and they're all localized and they haven't spread around. But the situation is the following. Oftentimes, and it's not, and let's put it this way, it's not insignificant, biopsies and surgery done at the wrong time inappropriately have the risk of spreading cancer cells around the body. So you say, oh, I got rid of the tumor, and then all of a sudden, 6 months later, you got lesions somewhere else. That came from either the biopsy or a surgical procedure that was done before you put the tumor into a dormant state. The tumor has got kind of an inflamed mass. At least the solid tumors are. Blood cancers also rely on the same two fermentable fuels, but they're in a liquid environment to a large degree, but not to a total degree. But when you have a very angry, inflamed mass, and then you try to go in there and debulk it, or even take a biopsy of it, or whatever you do, you run the risk of spreading things, because the fragments of the tumor will get into the bloodstream, even in tiny, tiny amounts. And those cells then, in time, will have an opportunity to survive. So when I say we have tools, what we like to do, and what we are encouraging oncologists to do, is when the tumor is first detected, whether it's by a PET scan or some image, we like non-invasive imaging, things that you can see that there's some mass there, you don't really know much about it. But why don't you take the patient and put them into a state of metabolic therapeutic ketosis? And what we find is that the inflammation goes down massively. Tumor cells start to die, and the borders, the margins of the tumor become very sharp, and the tumor shrinks. Now, the surgeon would have a much greater opportunity to completely debulk the mass without running the risk of spreading it around. So that's how surgery could be significantly improved.